this that there's no right or wrong, and it's more about collaborative learning. So we're here to learn from each other instead of trying to, show superiority over each other. So yeah, we'll start, and I'll present my screen. Please let me know if you could see my screen, right? Okay, is it visible? If I could, yeah, right. So when I'll be presenting, it's best if you could unmute and speak so that I can hear you because I won't be able to see you, right? Okay. Right. Can anyone see, like everyone see the presentation?
Yes, it's visible.
Thank you so much. So I usually begin with a group contract since, like I mentioned, it's the first time I'm meeting you as a facilitator. So I'll just read through a few guidelines which we as a group will follow throughout today's session. We as a group will respect a member's decision if he or she does not want to share his or her work. Group confidentiality is extremely essential. We will not disclose personal experiences of others are shared here with people outside the group. Anything which is shared by anyone here will be perceived in a non-judgmental way. Maintaining a positive and warm attitude towards fellow group members is essential. And lastly, if you don't feel like sharing or do feel overwhelmed at any point of time, you're free to drop a text and turn off your videos. Right? So with this, we make a start. I guess the first thing that comes up is what is depression? So who would like to share on what is depression, what you think depression is? Can we get your responses? There's no right or wrong. Who would like to go ahead? Prolonged sadness, right? Okay. Anyone else who would like to unmute and speak? Anyone? There's no right or wrong, like I said. Whatever you think depression is, because I'm sure we have all heard the depression. Right. So Monisha writes, loss of interest, feeling low over persistent period of time, self-doubt, right? Okay. Kosha Mehta, yeah, please go ahead.
Yeah. So, in my opinion, depression is both a physical and a mental state of mind.
Okay.
So, when we talk about our nervous system, we usually go in
Right.
a state of freeze, which is for a prolonged period of time.
Right. Right. True. Very true. Thank you so much for sharing. Okay. Less of confidence, feeling sad, irritable, empty, loss of interest in activities. True. Thank you so much for sharing, Kosha. Anyone else who would like to unmute and speak? It's best we all interact together. Persistent low mood. Right. Okay. So I guess what we came as a like as a conclusion as a group is that low mood, loss of interest, there's this feeling of sadness, and a few people also mentioned about how it can also be sometimes that we are irritable and we lack, pleasure. We can't feel pleasure. So I think the all of these things are very accurate and how to describe. And someone also I mentioned lack of confidence. So that's also something with respect to our own self, right? So self is also very important in depression, and that is something we'll be majorly exploring through today's workshop, right? So if we start with understanding depression, here is a definition which is given by World Health Organization. So it's a common mental disorder. It is characterized by the things you all mentioned for a long period of time. There's also regular mood changes and everyday life functioning is affected. So this is a very important point that we should all consider that their daily functioning or the daily level of functioning. For example, how you function at work, how you function in your family, how you function with your friends, so your interpersonal functioning, your intrapersonal functioning, your own relationship with your own self. All of these are severe to their functionality level has decreases with depression. So we'll briefly brush through the major symptoms of depression. So there are affective symptoms. Affect means emotions. So we all know depression is a mood disorder, and affective symptoms largely comprise of things like sad mood, feeling low. Sometimes people feel empty. They are unable to feel anything, or they are not at all feeling anything. So those come as affective symptoms. Or on the other side of it, they also feel everything very sensitively, and they feel everything very I would say highly, right? So they become very sensitive to things. So that's falls under the affective symptoms of depression. We move towards the cognitive symptoms. So when I say cognitive symptoms, majorly centering around your thought processes. So then there are those negative automatic thoughts that all of us usually think of when we think of CBT, right? That is there. There's loss of concentration. You're not able to concentrate on your work. Attention is a big deficit that usually people with depression face, right? And there's also something called cognitive distortions, which a lot of people face. That is, their way of thinking is distorted. For example, a depressed person might always think of the worst possible outcome, right? Or they might just jump to conclusion without even thinking through the entire thing. So these are cognitive distortion. Then we have the neurovegetative symptoms. Now, neurovegetative symptoms, if you remember the definition from biology, vegetation is basically restoration of energy. So neurovegetative symptoms include lack of sleep, lack of appetite, your libido decreases, and which overall also decreases your overall functionality level, right? Now, altered view of self, world, and future. So this is exactly where we'll be probing through the workshop, and we'll see how art can intervene in this area. So this view and how one perceives their own self, the world, and the future is distorted. I don't want to go much into details because there's a small quick exercise which is coming up regarding this. Decreased functionality, like I said, they aren't able to function in their social relationships, their occupational functioning. Adolescents who are students, their educational functioning is decreased. So these are very classic symptoms of depression, right? And also there are two things which most of you said: anhedonia and apathy, that is lack of interest and inability to feel pleasure in anything, right? So like I said, these things are very classic symptoms of depression, but also remember, these symptoms can present in a very varied and different fashion. Because when you see depression, and when you see, for example, melancholic depression, it's basically early morning awakening. They feel extremely depressed, and the whole intensity of the depressive episode, it's very intense during early morning, right? And also when you see atypical depression, usually people who are depressed, they lose weight, and their appetite has gone down and sleep has gone down. But for atypical population, it happens the opposite. So what happens is they start eating more, they engage in overeating, and they engage in oversleeping as well. So the weight gain is also there. So why this is important? Because you also need to screen out what kind of symptoms your patient or client is presenting with, so that you can modulate the whole intervention according to that, right? And also it's also always best to screen out for manic symptoms. Depressive patient comes in, so that you know that this is not bipolar and this is just pure classic depression, right? With this we'll move forward, right? Something very important: trans diagnosis. So I'll just briefly give you an idea of what trans diagnosis is. Trans diagnosis basically means depression has the ability to present not only as depression but also through various other disorders that we usually know. So then there's mixed anxiety depression, right? And then there's somatic symptom disorders. People who have so much somatic symptoms and psychosomatic problems, they also could have comorbidities of depression. There's dissociative disorders, there's trauma, there's neurodivergent conditions like ADHD, autism, for children as well as in adults. And also there's stress related disorders like adjustment issues, adjustment disorder, acute stress reaction, and also prolonged grief. So it's also best to keep in mind that if it is it like just depression that you're treating, or is it, it goes beyond that, because there could be a lot of things which is happening with your client. So this why I'm putting forward this for an art therapy for depression workshop or a session is that you have to tailor your intervention following your diagnosis of your client, right? So this part becomes very crucial when you're looking at designing an intervention which is suitable for your patient, right? Okay. Before this, any questions before we move to this section? Any questions? Right. Okay. Now the question for all of us is, why art therapy for depression? I think this is something we need to engage in as a group. Why do you think art therapy for depression? Come on, go ahead. There's no right or wrong. Speak your mind. Yeah,
Sir, can
Kosha, go
I?
ahead. Yeah, go ahead.
Sir, maybe because as we have seen that when a person is in depression or feels like low, so they are more, they are less into colors, and
Okay,
they express through colors like dark colors, and their art says it all, like how they are
right,
feeling.
right. So expression is what you're mainly trying to emphasize on. Am I right?
Yes, yes.
Right, right. Thank you so much for
Uh,
sharing.
Sir, can I add
Kosha,
to it?
yeah, yeah. Can we have
Yeah,
Kosha
actually,
first? Yeah, can you give me a
yeah,
second?
yeah,
Let
yeah,
me
sure.
actually raise
Yeah,
my
yeah.
hand. Yeah, Kosha, go.
Thank you. So, sir, I believe that while we use art therapy, there are
Mhm.
certain interventions where we use colors, and
Right,
colors can also be a good healing medium for the client.
true.
The only thing is key, it has to be a consistent usage
Mhm.
because as they face anhedonia.
Right,
So when they are exposed to, we usually use behavioral activation techniques. So
right.
art therapy can also be integrated with it.
Right. Very true. I think what you said completely makes sense because uh, people usually don't think of the fact that you engaging in art therapy itself is a form of behavioral activation and also is a sign of progress that the patient is making. Right. Very true, Dosha. Thank you so much for sharing. Yes, Raksha, go ahead.
Yes, I just want to add to what they said. It's therapeutic, and as someone correctly said, it's used for expression.
Right.
Any other modules expressing in through other modules can be hard, but the dark instinct or whatever hidden or latent instinct ca- uh, can be outcasted very easily through arts. So I think
Right.
it's that way
Right. True.
useful.
Very true. Thank you so much for adding. Anyone else? Lovely answers. You all already know it before me shedding light on it. Any other answers?
I just want to add to it.
Yes,
Just
please.
like provides a non-verbal expression. Like you can, art therapy. So verbally, if we are unable to express something, but using an art therapy, maybe it'll help us to, express our emotions in a normal verbal way.
Right. True. Very true. So I guess most of the answers centered around expression, which is extremely an important element of art therapy. I think Dr. Ria has ingrained that inside your brains by now on. Um, Along with that, something which we are going to look at is what's the science behind it, right? So when I say science, let's look at a bit of biology and try understanding what happens in depression and what exactly art therapy can do, right? I'll make it very simple so you don't need to worry about it, right? And anytime you feel that you can't understand, please just let me. Okay. So I guess all of you have answered why art therapy for depression. Now, here is also my answer. So what happens during depression? This is a very simplified diagram which I could find of what happens to your brain when you're depressed. So there are a few parts in the brain. So if you look at the prefrontal cortex, which is basically responsible for your executive functioning. And when I say executive functioning, it's basically thinking, decision making, problem solving, reasoning, and all your logical thinking that you do, right? In a very layman terms, that is impaired in depression. So when I talked about the cognitive symptoms of depression, loss of attention, negative automatic thoughts, that prefrontal cortex has a role to play in it. Next, we move to amygdala. Amygdala, I'm sure a lot of us know that it's the center of emotion. Amygdala is a very common brain part which is replicated across variety of neurotic condition, not just depression, anxiety as well, right? So what happens is there are what like two things can happen. One is there's overactivity in amygdala. That is, the person is feeling a lot of things and the person is very overwhelmed, right? And there's underactivity. And when I say underactivity, the person is not being able to feel enough, right? So it's also called blunting, emotional blunting or flat effect, right? So this is what amygdala's role has to play in depression, very simplified. Thalamus is, as we know, is the relay center. It integrates all our senses and then sends it to the brain. So what happens is that the inputs or anything that the person is perceiving, those signals are not integrated in a very, how would I put it, in a very adaptive way. And when I say adaptive way, those signals are sent out to different parts of the brain, and the interpretation of those signals is very distorted because of these different activities in the brain part. So, like as you say, increased levels of activity in depressed individuals' thalamus. Then there's cingulate cortex. Now, cingulate cortex is a very important brain part. It's responsible for sense of self, right? And also is responsible for goal-directed behavior. So what is goal-directed behavior? It's basically a behavior. For example, you want to have a glass of water. So you get up, go to the other room, to take a glass, hold some water and have it. So your ability to do that, that is somewhere also mediated by cingulate cortex, right? So that is inhibited. Now that is which basically causes your loss, inability to feel pleasure and also the loss of interest in the different things and your inability to carry out your daily function. So these are a few major parts which regulate in like in depressive disorders. Very simplified version. Now, what art therapy does is it intervenes here. Exactly, right? So if you look at frontal lobe, like the prefrontal cortex, there's hypofrontality. And what is hypofrontality? Remember, hypo means less, hyper means more, right? We all know hyperactivity. So hypo is the opposite side of it, which means less. So your brain is not being able to function as much as it is required, right? For let's take an example of the prefrontal cortex. What art therapy does is it increases the neural connections and it helps to bring back the levels of different brain parts into the normal state of activity. So for example, if your amygdala is overactive, you're feeling a lot of things. When you paint, you instantly feel relaxed, right? What happens is the overactivity reduces, you channel it through art, right? So that is where exactly ATD or art therapy for depression intervenes. Now, if you want to look at in a very logical way, this is what happens. Now, this is just a picture I thought of adding. So this is a PET scan of the brain of a person who's depressed and not depressed. So see, okay. So remember, the orange and the yellow light means there's a lot of blood flow, and the blue and the greenish light means there is less and decrease in blood flow. So when you see a depressed person's brain, the blood flow circuit has significantly reduced compared to a non-depressed person's brain, right? So this is also what happens inside your brain when you see from a metabolic point of view, right? Now, why am I telling and showering so much information to all of you? You need to psychoeducate your patients before you start the therapy process. And what do you mean by psychoeducate? You need to make them understand what happens in depression, also present them a sort of treatment formulation or when or how are you going to help them using art. See, this is a very important point. If you have a very solid psychoeducation program for any, like most of your clients, you are telling them what is it that is going on with them, what happens in depression, and how the treatment method that you're following is going to help them. The compliance to treatment, or in other words, the person willing to come to therapy, that willingness increases, right? And they start following your instructions or whatever homework that you're giving, they are bringing it back in the next class. So psychoeducation is very important. So when you know this whole basic neurobiology, you don't have to get into a lot of things. There are a lot of hypotheses, a lot of neurochemical changes. But if you know the basics of these things, you're able to explain them, right? And they'll also further then value your treatment that you're going on. Right. I see Charitra ma'am and Kosha's hand raised. You want to ask something?
Yeah, Charitra here.
Yeah. Hi.
Like you were telling that the executive functioning of an individual is affected,
Right.
and like how is it same or different when we look at executive functioning difficulties with children?
Children in the sense like neurodivergent children,
Yeah,
ADHD,
like
autism.
some children have like or face executive functioning difficulties. So how is will that be related somewhere to uh,
Right.
I mean, so
Right.
no, I
Yeah.
just
So you
wanted to,
want,
yeah.
yeah, you're asking how you can differentiate if it's depression or not, right? If
Yes,
I'm getting
yes,
it
yes,
right.
correct.
Right.
Yeah.
So depression, like I mentioned, other symptoms would also be there. There would be the affective symptoms. There would be some form of sadness. Now, for children, depression presents in a lot of different ways. There's a lot of social withdrawal, right? They
Mm-hmm,
try to
mm-hmm.
isolate themselves. They do not want to go out. They become quiet, and their activity level that is expected at the particular age usually decreases. So it's very
Mm-hmm,
observable when you see a child who's probably going through childhood depression that he's very different from his
mm-hmm.
peers, right? And the
Okay.
executive functioning deficit, for example, a child with ADHD autism, that would be very different from this depressive presentation because the depressive presentation also includes the affective symptoms and the other symptoms. While ADHD, you have a few diagnostic, guidelines that you can follow, like the
Mm-hmm.
inattention, hyperactivity. Then you can differentiate between them. I hope I answered your query.
Yes, yes, yes. I have another question.
Yeah, go ahead.
Like, if when we start working with individual with depression, so
Right,
is there any like pre and post assessment or like
right. Yeah,
anything that we can,
yes, we
like
could.
say that okay, this person at this level and now at this level. So
Right,
is there any uh thing like
tools.
that?
Right, right.
Mm-hmm.
Thank you so much for bringing that up. I've attached it at the later section of my presentation. I'll go through them as well. Right.
Okay, okay. Thank you, thank you.
Thank
Okay.
you. Yeah. Okay. Kosha, you want to go ahead? Okay. Anyone else with any doubt? I would like to clear before we move on.
Sir,
Yeah.
sir, as you said that, and we have also seen that the depression patient also feels better, and his mind or like he feels relieved. So I have just one query, like how does it channelize it, or how how it makes a person relieved and calm while doing the art, like
Okay, right. I would love to answer this, but after we do the activity and after you also go through it and we'll see how you feel and then we can, take this up at the end of the session. What do you think?
Sure, but how does it go in channels, like we have seen the brain structure, so how fast it gets effective in that sense? I hope
Right. So
conveying
yeah,
my
you're asking from a neurobiological perspective. I can answer.
yes, yes, sir.
So what essentially happens is, so for example, let's say amygdala, right? Overactivity of feeling a lot of things, right? So Shwetnil, what do you usually do when you feel overwhelmed?
When I feel low,
Yeah, when you feel overwhelmed, like for example, there's a lot of things that's going on with you.
I prefer to listen songs.
Okay,
I feel I can dance, or I can sit alone and process my thoughts,
right,
sitting in a balcony or anywhere.
right. So when you're doing this, the overactivity. So when I say overactivity, remember each brain part has different neurons, right? And they release something called neurochemicals, right? Neurotransmitters in a very technical language. So when the neurotransmitters are releasing in excess, we are basically saying that, yeah, there's a lot of overactivity. So when you engage in something else, the level of overactivity that continuous firing of neurons of those extra neurotransmitters, those decreases over time. Right now, how it decreases, that's a very complex process. It gets, it channelizes and everything. That's a whole different. It goes through your muscles, and there's this neuromuscular junction. How transfers from your neuron to your muscles and everything. But what happens is the chemical that's releasing in excess, it gets channelized through your body. Like for example, when you dance, even when you look at expressive art therapies, dance therapy, for example, dance and music therapy, what happens is when you're shaking your body, there's an exercise called shake the feelings of your body. So what they do is when you're feeling overwhelmed, you just shake your body and just shake the feelings that you're feeling over your body, and that works great because you're channelizing those excess pent up energy. Even if you go by the basic catharsis law, that when you're filling a jug and when it reaches up to the brim, it will overflow. It's basically sort of that, but it's in a more biological fashion, right? I can send you a few resources if you would want to read on, details of how it
Sure.
exactly.
Sure, sir. I would love to, and whatever you have explained just now I can process how does it works. But I would love to read the material as well, sir.
Right. Yeah. And we'll definitely review this after we are done with the exercises, right? Thank you.
Yes, sir. Welcome, sir.
Yeah, Kosha, go ahead.
So depression can also be expressed through anger, right? So the person is experiencing lots of anger, but somewhere there is within sadness. I mean, I believe that there are mixed emotions, and
Mm,
it can be really very overwhelming for the client because the person doesn't have clarity that what actually the person is feeling.
right. Right, true. And I think, depression presenting itself as anger is a very common thing that you'll see in men, specifically Indian men, right? Because Indian men have been continually taught not to show their emotions or feel sad on the other side of the spectrum, but it's more about being angry and following the patriarchal structure. So it's very true. And for those cases, your first line of treatment should be reduction in anger. There are a lot of exercises, the swivel exercise, use art-based intervention, and also something that you really need to make them understand is that anger is not exactly a primary emotion; it's a pent-up build of an emotion. So if you look, I'm not sure how many of you know the anger iceberg activity. If you know the anger iceberg activity, the anger is only the tip of the iceberg. Below the iceberg, there are a lot of feelings: shame, guilt, jealousy, sadness, pride, and a lot of things which accumulate and turn and present itself as anger. Right? So keeping a check on these things will also give you some more clarity. Right?
Yeah.
I hope I was able to answer and give you a good brief intro. Yeah, right. Okay, so we move forward. I'll not start off with the screen, but okay. Now, what about other effective therapies? We have talked about how art therapy is important, right? But now let's discuss why art therapy, why not other effective therapies? Can we have a few names of other effective therapies for depression that we know?
CBT, sir.
CBT, right? Yeah.
Yeah.
Anything else?
Movement therapy, music.
Okay, right. Okay, let's keep the expressive art therapy.
EMDR.
Okay, EMDR. Okay. Strength-based problem
REBT.
solving, right? Okay.
REBT.
Right. Behavior therapy. Right.
Yeah.
So there are a lot of different modalities. For like, for example, there's acceptance and commitment therapy. There's dialectical behavior therapy. You'll get a lot of different therapies. Now, depression is a disorder that has been clearly very well researched with and used on like following different therapies, and the results have also somewhat shown that yeah, most of the therapies work for depression. Now, I want to ask you, why do you think, why or when art therapy, when not CBT and the different therapies that we then? Any quick thoughts?
CBT when the individual is ready to speak, but when in cases where they are not ready to express, then maybe art therapy.
Extremely correct. True, because uh, the main thing with a lot of depressive patients, the biggest problem is verbalization. And when I say verbalization, it's extreme. Like all of you were talking about expression. That is exactly the area that we need to tap as a as therapists, right? Because verbalization and verbalizing about their feelings, their thoughts, or their experiences is extremely difficult and a stressful thing for people who are depressed, right? So that is why art therapy even works for people who are severely depressed, like severely depressed in the sense that they can't function at all. So there are levels of depression: mild, moderate, severe, if you look at. So people who are severely depressed, art therapy works amazing for them because of this element of they don't have to verbalize. When you are engaging in the art process, the patient automatically will start verbalizing when you discuss the drawing, right? You don't have to discuss direct life
Sir,
experiences.
sorry for disrupting. I have a doubt here.
Yeah,
What if the severely depressed patient is not having any interest in doing artwork or have zero interest in doing anything?
right. Okay, so
Very
what do we?
reluctant clients.
Yeah, so I think for that you have to have medicines and the pharmacological treatment as the first line. That has to go because once the medicine stabilizes them, then only you can engage in therapy because these things cannot be forced, and some amount of willingness in the beginning has to be there to engage in art therapy, right? Because it's easier than verbalizing and directly engaging in talk therapy or just talking about your what you're going through. But people who are severely depressed, medicines and pharmacological treatment is essential. If you're saying that kind of like they're on complete bed rest, for example, you need to refer them to a psychiatrist, get their medicines. Once they stabilize, then you can start off with therapy. Yeah.
Thanks, sir. Thanks for the insight.
May I?
Yes,
So,
Kosha.
so one thing what I have seen
Mhm.
is when a person is depressed or highly anxious, their logical thinking doesn't work well.
Right. Right.
So, art therapy can help because ultimately there is mindfulness. Ultimately, when the person starts concentrating a bit on
Mhm.
the activity, it can change
Yeah.
the processing to a bit.
It does. So, what the logical thinking that you're talking about is basically a frontal lobe function. We talked about prefrontal cortex, right? And the hypofrontality, what happens in depression. So, that is exactly a frontal lobe function. And we'll see in today's activity how it happens. It's better if you experience it before I say it. Well, keep in mind, and we'll discuss for sure. It does work. Yeah, at least when I have applied it to my depressed people, like clients who have been going through depression, it has worked for them. And there's some evidence as well that it works. So let's see in today's exercise if it works for all of you as well. Right? Kamakshi ma'am, you want to go ahead?
Yeah. I just would like to contribute in the sense that when the rapport is taking a lot of time, okay, that is when we can introduce one of the art forms. There is a little bit of facial expression, a smile, or some hesitancy which the client or even the child has is easily kind of weighted, So it is good to introduce when you yourself as a therapist. I mean, I myself as a therapist have faced that sometimes I'm not able to crack it. There are too many layers. There are too many things. The client is not chatty. Is confusing me. So that is the time I've tried art therapy, and it
Right.
has really worked.
Right. It is like what you're saying is completely very good practice when you think that there's some there's like no direction that you're finding in art therapy, like in therapy when you're engaging with your clients. And I can also understand it might sometimes get tough because either someone who's sitting in front of you is expressing so much and things are not well connected, you can't understand what's going on, or there's someone sitting in front of you who's not being able to express anything. So it's a very good point that you put forward. Also coming to that, something which also rings my mind is that you also keep a check on counter transference when this happens, because if you see something, there's I don't remember the term, but there's a term which is called when you try to supply art therapy and try engaging in these techniques when you are not being able to do good work with your client. So that is extremely important. So keep a check on your counter transference when if you're feeling very irritated before the session, or you think that again I have to take this person's session, or there's no progress, he or she is not being able to do anything, what can I do if they are not working on themselves. And if you see that those are the moments when you're only incorporating art that means that there's some sort of supervision that you need, and get your goals redirected and see what happens. Because always remember, these techniques are not a substitute for your therapeutic skills, your talking skills, your rapport building skills, your basic reflecting, validating, empathy, positive regard, congruence, those skills, right? So it's extremely important to keep a check on these things as well. Thank you so much for bringing that point up, man. Okay. So, yeah. So essentially, it's about verbalization, like we put forward, and how it is a big deficit in people who are going through depression. They are usually not able to verbalize it accurately, or maybe even if they are trying to verbalize, they can't. So these things are there. So that is where art therapy intervenes. Now, when you have these info, if even if you're taking down these down in points, it's best, so you can, you know, club all of them and make a psychoeducation script out of it, which you're providing to your clients before you start art therapy for depression, right? Okay. So the classic aims for art therapy for depression, if you see for an ATT intervention, is enable patients to become aware of physical symptoms, thoughts, and feelings. So awareness, enable patients to relate and deal with physical symptoms, thoughts, feelings in a more functional way, right? So it's best to use the term functions of healthy, unhealthy, because it somewhere categorizes the person into that whatever they are doing is not okay or should not do according to social standards or whatever it is, right? Because that is when they are engaging in a form of behavior even which you think is unhealthy, that is probably the only way out they can find, right? So we should also keep that in mind and sort of empathize with that as well, right? Now, enable patients to accept themselves regarding activity level, performance, and ability. Very, very important point. Acceptance is the first step probably to most sort of behavior change, or our ultimate goal of changing from the symptomatic presentation to an asymptomatic state of the patient. The person first needs to accept the fact that yes, these things are happening to me. So art can give a very good medium to represent and see, yeah, these are the things that has happened to me, and this is how I am probably going to go through for a few weeks or months, right? To enhance perceived self-image in relation to self and others, some activity which we are going to do today. To enhance verbalization and activity level, like all of you mentioned, the goal is always to increase the patient's quality of life. So this is something very important. Quality of life, when you look at it, it's also very subjective. Try understanding and evaluating what the patient means when they say that I want to live a good quality of life. And when, for example, a patient coming to you and saying that I don't want to live like this, I wish my life was different. What is the different? What does the patient mean when they say that my life was different, right? You could assume the fact that yeah, different means you don't want to feel this way and that, but what exactly is different according to them? That is something that we need to go by and follow, right? And the goal with treatment is to improve patients' ability to deal with daily life, right? So daily functioning. Okay. Now we move to applying ATD. So the whole theoretical construct part is over. This is what we had to discuss for today's workshop. Now, how many of you know this triangle? Any answers? I can't see all of you, so you can unmute and speak. Do we know what this triangle is? Anyone? Do we have any?
It's the Beck's triangle of helplessness, like the
Right,
one we
right.
used to see depression in the light. So this is used for when we check whether what part the depression lies. Like, is it for the future? Is it for the world view? Is it for the self view? Or it's the three of them combined together?
Right. Completely true, Shuman. Very accurate description of it. So this is the Beck's cognitive triad of depression, like as I guess someone else also did mention, I guess Nancy ma'am did mention. So this is basically Beck's cognitive triad. Now, I'll briefly explain what it is. It's a very simple uh, triangle that we have. So Adam Beck, 1979, described and put forward a proposition that during depression, like we mentioned, there's altered view of self, world, and future. It presents through a triangular fashion because these three are the same sides of a different triangle. Sorry, different sides of the same triangle. So we have self, there's worthlessness, which you are very clearly able to see in depression. The future, the attitude of how you perceive the future is hopelessness. There's less hope for change, or there's less hope for improvement in life. Nothing is going to change. And for the world part, there's helplessness, that I don't know, I won't be able to do it, or for example, no one's going to be there for me. So these are a few thoughts which generally come up when you look at this triangle. So you're a patient in front of you, for example, if they are talking about worthlessness, they might talk about the fact that it's all because of me, or maybe that I could not make myself, better. For example, someone who has betrayal trauma, right? Betrayal trauma is basically, let's say, after cheating, the person has become depressed, right? Their partner has cheated on themselves, so the person might have feelings regarding that. I was not enough for my partner, right? So that denotes worthlessness. Then on the similar line, there's hopelessness. No one is ever going to love me because this has happened, right? And the world, like no one is there for me. The feeling of loneliness, that's helplessness, right? So this is basically what the triangle denotes and what the triangle is, and we'll be having activities centered around this triangle, and this is going to be a little bit elaborated. So we'll see how it functions and what happens to the session, because I'm sure most of us are very well equipped with basic techniques like paint your feelings and draw yourself, or your own how you're feeling, your thoughts and emotions represented through a collage. But let's do a bit of in-depth work and see into the what happens in the self structure when a patient is depressed, right? um, we have hands-on techniques, but before that, any questions I would like to take up quickly? Any questions? Is everyone clear regarding what the triangle is and what it means? There are three sides to it. Okay, so we move forward to the techniques. Now you'll be needing your art materials for this. We'll start with the technique to explore hopelessness. Please give me a sign when you're ready with your art material so that we can begin. If anyone could unmute and speak, that would be great. Are we ready?
Yes, yes.
Right, right. Thank you so much. So what you have to essentially do is that you need to draw a line. You need to take a horizontal sheet and draw a line in the center of the page. Right? Just draw a straight line. It does not have to be exactly straight, but just a line. Right? And on middle of it, you need to just represent yourself. You can use a stick figure, you can use a dot, or you can make it as creative as you want, but it just has to represent yourself. Now, on the left side of the line, or from where you're standing, like if you're standing here, your left would be here, I guess. So from your left side of the drawing, you need to represent whatever has happened to your life, the good, the bad, through little symbols, or it could be through any, paint strokes or whatever. But it just should represent something, the major events in your life, the good and the bad both. It has to include both, and it has to be a realistic representation. Like, I know a lot of people could, incline towards just representing the good things or the bad things just, but try really thinking it through and try reflecting and introspecting on the fact the good and the bad, both. You're going to make a very accurate representation of it. Are the instructions clear? We'll have around 5 minutes to make this. It does not have to be very pretty and elaborative. Then we'll come back as a group and discuss. Is everyone clear with the instructions?
So just one more time, could
Yes.
you please explain?
Yes.
Once more, could you please explain?
Yeah. So what you have to do is you have to draw a line from the center of the page, and that will represent your lifeline, right? And you have to draw yourself in the middle. Now you can represent yourself using a stick figure or a symbol or whatever you feel like. That's completely up to you. And on the left side of it, you have to draw your life history, like your life history, that whatever has happened to you, the good and the bad, right? That could be like anything, like for example, when the day you got graduated or something terrible happened to you, like example, you broke up with your boyfriend or your girlfriend, anything, right? So those things have to be represented on the left side of it. Now that has to be an accurate representation. So you cannot only represent the bad things. Yeah, my life has just been bad, or my life has always been good. Uh, Very realistically, no one's life has always been good, always bad. We have had a mixed share of, we are a mixed bag of things we experience. So that is what you need to represent. We clear on the instruction, and post we represent, we come back as a group, and then we discuss.
Thank you so much.
Right?
Hello.
Yes, 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 Tina.
So, do we need to represent all the major events or few of?
Whatever's coming to your mind right now,
Okay, okay,
whatever comes to your mind, just should have some sort of representation,
sure.
right? Yeah. We'll meet back at 11:51 as a group, right?
Only symbols, or we can write names?
You can.
Okay.
There's no fixed code.
Okay, thank you.
We slowly come back as a group now. Right. Are we all done? Any responses?
Yes.
Right. Okay. Now we come back as a group and we share. I know it's a bit, we are hurrying it up, but with your client, remember, you have to give them as much time as they require. There's no hard and fast rule that do it in 5 minutes. Right. I know these things take some time, but since we are, bounded by a time limit, we have to follow this. Right. Okay. So quick thoughts. How was it? Introspections? Anyone who would like to go ahead?
It's just that life has been very eventful.
Okay. Right. You said the life has been very eventful.
Some repressed thoughts are coming up.
Okay. Right. Well, are you being able to reflect on them? Like, what do you think they mean? You don't have to say the thought out loud, but what do you think they mean to you? Right.
Actually, we all the time focuses on our sadness or whatever we have not. I mean, uh,
It's okay. Take your time.
actually, we forget to gratitude, maintain gratitude. That's why.
Right. Thank you so much for sharing. Anyone else?
No, sir, sorry. I felt like something was bagging around me, and I didn't even realize that. So I can quickly understand that. Okay, this has been troubling me since back, but I wasn't giving more importance to it, and now is that is coming instantly. So without any efforts, I realized that.
Okay. So you wanted to convey that you've become more aware of the fact, right?
Exactly. I thought that is not disturbing me at all. That particular thought or that particular event wasn't disturbing me at all. But as soon as I thought some sad event, that was the first event which came to my mind. So now I can understand the seriousness it is taking towards my mental health.
Right. Right. Thank you so much for sharing. Anyone else? Lovely responses. I'm very glad that we are an interactive group today. Anyone else? Any quick reflections? Yes, Kosha, go ahead.
Yeah, so I just have a doubt. So, on the left hand side, we are noting down the good moments. Am I right?
Not necessary. It's just
Okay,
it should represent your life sort of history, and you can put
okay,
the good and the bad. It has to be an accurate.
both. All right, all right. Okay, thank you.
Yes, Shagorika ma'am, go ahead. Ma'am, you want to say something?
So life is a mixed bag.
Right.
So good moments are also there, bad, worse moments are also there. But as a human being, we need to move on.
Right.
We cannot stay there.
Right. Thank you so much for sharing that. And I would like to take that forward with that thought and move to understanding the areas that we are going to reflect. Is it okay if I present it like this? Will it be a huge problem for all of you? Because uh,
It's okay.
it's okay, right? Yeah, because I would like to see all of you as well. Right. So, areas to reflect. One is past, present, future. This activity exactly is what you all have faced. That is the mixed bag of feelings. I remember, like Kamakshi ma'am said, life has been eventful. Now, eventful is a word that is a very ambiguous word that we generally use, at least I use. It represents the good and the bad both. Now, if you remember, this activity was for hopelessness. So when you represent that, yes, there was good, there was bad, you also feel sort of hopeful of the fact that, yes, even though what I'm going through right now is bad, there is possibility of, you know, good, because it has always happened this way, right? So the past, present, future is one area that you could probe with your patient following this activity. Secondly, is there a pattern? Now, this is a very important thing that you could probe on. The fact that, yes, there was a bad event, something good happened. Again, some bad things happened to me. Again, something good thing happened. So probe with that and work with that and try building that sort of acceptance of the fact that, yes, this itself is the dialectical nature of life. So if you know what dialectics is, that there's good and bad both. The life is that, life is exactly that. There cannot be just good or just bad. All of us have good and bad memories, good and bad experiences, and that is something that we usually live with, right? So these are a few key pointers and areas that you could reflect from this exercise. What do you think about these pointers? Do you think you would be able to probe with them? How would they work with your client? Any queries regarding these pointers? Anything that comes up? Yes.
Can I ask?
Yes. Go ahead.
Sometimes we feel we are practical. We know we have to move on from any situation, but we don't know how to move on.
Right.
Yeah, we are stuck there. We are struggling to move on, but we are not able to do it. In that case, what to do?
Right. That is where the pattern thing comes up, right? So then you can also ask your client to reflect on, see, there was also this bad experience that you faced, for example, 2 years ago, right? And then there's a good phase in your life that came in. What do you think exactly happened? How did you transition to that good? Make your client reflect on these things, the patterns of life, how the person's life has generally been, right? How generally life is for most people, right? So, yeah, go ahead.
See, the situations are different, but sometimes when we lose someone who is very dear to you,
Yeah,
accepting that becomes very tough.
yeah, it is tough. It is tough. And it's best not to lie about the fact that it is not going to be tough. And yes, you can move on. Acceptance takes time, but it happens gradually. It takes a lot of time, right? And different people have different ways of processing a lot of things and processing grief, for example. I remember I've heard of a patient whose husband had died when she was around, not sure, around 30, late 30s. So she used to come back home and she used to have tea, make tea for herself and talk to her husband's photo frame, right? And her family members got very concerned seeing that. But when in therapy she was talking about these things, it was almost as if that this is what is the only moment that she feels happy about, right? She looks forward to that, point of time in the day when she comes back from work, makes tea, and just talks to her husband's photograph. So there's always that thing that, yeah, you cannot move on, or you're not when you're you can only move on when you forget everything and you're happy again, right? So that is where the dialectical nature of life comes in. Yes, there is ambiguity. There is not necessarily when you say that you've moved on, you're perfect, you're doing everything, right? It's a very gradual, slow process. It's almost invisible, right? And suddenly one day, after a few years, you realize, yes, oh, I probably have lived, right? So this is, I think, a very good point that you put forward, ma'am. Thank you so much for that.
One more point. Sometimes I've seen in the same case that people around you don't talk to you about your loss.
Right.
But
Very.
as a person, many times we feel that we need to talk about the person whom we lost, and it makes you more comfortable and more happy. This is what you are saying about the cup of tea sharing with the husband's photo.
Right.
So this outlook has to be changed, that not to talk about the people you lost. It will, like, you will remember the same event again and again, but sometimes it gives you that peace and that happiness also. Like, I had observed that many times.
Right. Like the verbalization and the catharsis, what happens, it comes out of your system. It's very true. I also sometimes understand that when initial phases, when someone has probably, let's say, if we are talking about from a grief context, has lost someone, it becomes very difficult for them to talk about it. I would not like to force them initially to talk, but eventually it's a very good practice if you're able to talk about your loss and monitor your feelings, right? If you can talk about it while feeling neutral and not feeling overwhelmed or not feeling extremely low, that's a very good sign of progress and of the fact that yes, you have sort of moved on from the situation. Thank you so much for your insights, man.
Thank you.
Right. Okay. Any questions for those pointers? I'll just briefly show the pointers again. These are the areas to reflect: past, present, future. Is there a pattern and dialectical nature of life? I think these three we have captured through our conversation right now as well. And I think these are a few key areas. There can be a lot of key areas depending on what your patient's problems are. But these are a few generic, very outline key areas that you can work on, right? Okay. We move to the next activity. Is everyone all right? Next activity. Okay. Right. Yeah. So
So I
activity
have one
two.
last doubt. Sorry for disturbing.
Yes. No.
Yeah,
No.
do we
No. Go
have something to do with the analysis part? When they draw their lifeline, the patterns they use, the symbol they use, do we analyze that?
Right, right. So usually, ma'am, there are two types of art therapy if you want to classify it broadly: directive and non-directive. So directive art therapy, you usually analyze symbols and see. But I feel when you are with a depressed client, it's best to not, put your analysis hat and just understand and see what your client is saying about the client, right? So you can analyze, but don't let that analysis color the way you're understanding your client's problems, right? Because after the drawing, it's the drawing of the client, and that is what the client is talking about. And if even, for example, if they say that, for example, they have drawn a heart and they say that no, this is a dead body, you have to go by that because it is representative of the inner world, right? That is a very important point that you have to bring, right? So it's okay to analyze. We do that in directive art. I'm sure you have received the symbols PDF that Ria ma'am has sent. You can, keep that in mind, but make sure that you don't color your mind and, you don't become biased towards that. If they use a lot of spirals, it somewhere means withdrawing tendencies. So why are they saying that they don't want to go? So that's a different story, right? I hope I've answered your question,
Yes, sir. Thank you.
right? Thank you so much. Okay, so the next activity is for helplessness. We'll be doing the cage drawing exercise. Now, what you have to do is essentially just take a sheet of paper and fold it, right? From the middle, hold it. And when you're drawing, make sure that you're drawing on a side and you aren't able to see the other side, right? So just keep it like this in front. So what you have to draw is, now again, it does not have to be pretty. You just have to draw a cage, right? Now you can represent it through using the jail bars. You can represent it through any, feeling any way you feel like, but it should be a cage. There will be two drawings. We'll be doing the first one and then I'll instruct you for the second one. But for the first one, you just have to draw a cage and you have to draw somewhere like yourself inside the cage. Okay, and just it's a representation. You can draw a stick figure, even a dot is enough, right? But it just has to be a cage where you are inside, right? We'll take 2 minutes for it. We'll do it quickly, right?
So in cage, what we have to represent? I just missed that.
Huh?
In cage, what we have to represent?
You just have to draw yourself inside through any form. It can be a stick figure, it can be
Okay,
a normal.
okay, okay.
We'll stop at around, let's say, 12:08. Yes, Padma ma'am, go ahead. You had a doubt? We stop and we come back and we move to the second part of it, right? Also, can we have a few more videos on? I would like to see all of you. Would be great. Yeah. Okay. So are we ready to move to the second part of it? So the second part of it, so you've drawn it in one side. Now just flip the page and draw on the other side the same instruction, you in a cage, but one of the sides of the cage, or maybe there's a door that is open, right? It should just represent that one of the doors or one side of the cage is open. There's some space for you to get out of the cage, but you're still in the cage, right? That is what I have to draw. Yes, ma'am, go ahead.
I actually drew it. The cage is open, and I'm standing at the
Okay.
like open gate of the cage.
Okay. Okay. Can you like modify it? We have some time.
Yeah.
Yeah.
Okay.
That's perfect.
So should I draw a new one?
For the first one, you can just modify it little bit
Okay.
and make it a closed cage. Right? Okay. Are the instructions clear for the second drawing? Then we can proceed. So for the second drawing, what you have to do is the same instruction. You inside a cage, but one of the doors is open, or maybe there's one of the sides of the cage is open. There's space for you to get out, right? But your stick figure still inside the cage. That is what you have to draw.
So can you repeat it? Actually, I got disconnected.
No, it's okay. I'll repeat it, Manjima. So for the second drawing, what you have to do is the same instruction, you inside a cage, but one of the doors of the cage is open, or one of the side is not there, and there's space for you to get out of the cage, right? That
Oh,
is
actually, I have drawn it in the first drawing.
okay. Okay, no, the first drawing for the
So what
instruction
to?
probably. Well, you could just modify your drawing, modify the first drawing of the
Okay.
cage, yeah, and make it a closed cage. Right. I should have been a bit more specific that you have to have a closed inside cage. Like,
Okay. Okay.
yeah. And we come back at 12:15. Please let me know if you're done before. Okay, I guess we close then. Have we come back as a group? Right, right. Done, done. Okay. If you're comfortable, do you want to show your drawings? Now, before that, you need to open the page first. Open the page so that both the drawing come on a single side. Who wants to show first and share their insights? Who would like to go first?
Go first.
Yes.
So this is my first
Same you.
picture,
Okay,
and this is my second one.
right. Now, thoughts.
So thoughts were like, I don't know, when I was in cage, when the cage was closed, that time also I was like pretty much comfortable. And when you said that the cage should be open, that time I just moved a little nearby the door.
You moved a little nearby to the door.
Yeah.
Any particular feelings or thoughts that come through your mind right now when you're talking about it?
Not really, but it was just not mine, but it was just like I was feeling like what people would be feeling when they are in the cage and how they would be feeling. And when the door is open, but they are not able to get out of the door. All those things were going on. Yeah.
Right. Okay. Right. We'll stop with this interesting insights. We could come back to you, ma'am. Thank you so
Sure.
much. Yes, Shalvarika ma'am. Go ahead. Yeah. Okay. This is the second drawing, I believe.
This is the first one, and
Okay, first.
this is the second one.
Right. So, how do you feel seeing these two drawings? What thoughts, feelings come up?
Yeah. So even though the door is open, lot of things which are holding me inside, not allowing me to move out. I'm trying hard to just to be free, maybe free, and I tried hard so
Right.
that I can break all those strings which are around to move on.
Right. So you're trying to say that you when the doors open, you're still trying hard to move on, but there's
Yes, because
something which is probably stopping you.
something is stopping me to move out of the cage.
Okay. Great. Thank you so much for sharing with the group. Anyone else?
Can I share?
Yes, yes, of course. I'll just tell you.
This is my first drawing.
Okay.
I missed your instruction. It should be closed cage.
Okay.
So, and this is my second drawing. There is
Okay.
a huge gap in the
Right.
cage. Okay,
Right.
and I introspect one thing that in my first drawing I missed my wings.
Okay.
Okay, and in second drawing I have my wings. And one thing I want to share that we all cannot free all the time. It means some restriction I will have. We will all have some
Right.
restrictions. So can't be free all the time.
Right. And any other feelings that you feel when you see the cage is open in the second
Uh,
drawing?
but I felt comfortable in first drawing also.
Right.
That might be the cage is open, but I am not flying.
Right.
And in the second drawing, it's I am flying. I have my wings. Okay.
Thank you so much for sharing. Any other quick last? We can take one more person's. Okay. Thank you so much for sharing. You've done my job for the explaining part. So two things which come up. One is just change the slide. Yeah. Okay. Things that you need to reflect on is three things. Why can't we get out of an open cage? Learned helplessness, personal power, and autonomy. I'll describe each one of them. But before that, the themes which came up is that A, most of us are comfortable in the first cage, right? When the cage is locked. B, even though the cage door is open, we somehow can't get up, right? So when you say when you're comfortable in the cage, so how many of us know the learned helplessness theory of depression? Can anyone who knows can shed light on it? Okay, I'll do that. So it was Martin Seligman who first described the learned helplessness. So what learned helplessness means is that you learn automatically to be helpless. It's basically what it means. Now, what happened in the experiment was there was a dog who was kept in the cage and who tried to get out for a long period of time, right? And he could not because the cage doors were closed. What happened is when he was transferred to another cage whose door was open, it was seen that the dog still could not get out, even though that the door was open. This is what exactly happens with most of us when we feel helpless, right? This is a metaphor that, this is a very good metaphor that you can incorporate when you're working with a client who's depressed and who feels that, I am extremely helpless. I cannot do anything about it, right? The first part of the drawing where you say that you're very comfortable. Yes, ma'am, I'll take that question. Give me 2 minutes. The first part of the drawing when you say that you're very comfortable in the first space, like yes, even though when the cage is closed, that is exactly what happens when we become very comfortable to living our lives the way, even if it's hurting. Let's take an example of toxic relationships, something which is very common, right? People can't get out of it. Why? Because that is what they've all known. That is more comfortable to them, right? Because changing and moving to a different new relationship or, being single is something which is very new to them or, which is going to induce a lot of changes in their lives, right? So first drawing, like most of us, I think very accurately captured that we are comfortable. The second drawing, in the other hand, you all have somewhere sort of realized that yes, there's something that we can't get up, which is pulling me back into the cage. So when your client says that, probe on these things. What do you think it might be? You're saying, do you think this somehow represents your life? These are a few questions that you can ask your client, right? And also use the metaphor, right? Show them that why a cage, like, what does the cage is the representative of? Perhaps the situation they are in. They think that they are completely helpless, right? So that is a very good area to reflect on. Now, why can't we get out of an open cage? Something like we discussed right now, like why exactly can't we? What is it that is pulling you back? Learned helplessness, like we told you that we eventually learn, to be helpless when we are helpless for a long period of time. Also focus on personal power and autonomy. And now what does personal power and autonomy mean? It means that you have the power to get out of the cage. It's in a very simple line, that is it. You can make your client realize that, through a lot of ways, right? For example, let's take Manjima ma'am's drawing. She told that, for the second drawing, she has wings. Probe with that. What does the wing signify? Does it signify that yes, you have resources, you have strength to move out of the cage, move out of the situation? The first drawing, you said that you don't have wings, right? So these are elements which will eventually show up in your patient's drawing. So it's a very good exercise to probe and see. And it's also, it might be a bit heavy for most of us, right? Because these are things which we also feel very deeply. So make sure that you're probing enough and you're not very directive and not very aggressive when you're probing, but very simply and gently you're putting forward the fact that, these things can happen. Use statements like, usually when people say that the cage is open and still they can't get out, they mean that something is holding them back. Do you think something is holding you back? Putting forward these things forward a very gentle and a non-directed way with them, right? I'll be taking a few questions. Yes, Chaitra ma'am, go ahead. Ma'am, you wanted to speak or
Yeah,
ask?
yeah. Uh, I like at times what happens is like, okay, if someone feels that uh okay, they have to break open the cage and like walk out or like do things that, I mean, feel like they feel less bonded or like, but people around them are like used to them being in certain ways, and when they see that, this person is changing, uh sometimes creates a lot of rift or like uh, conflicts.
Right,
So how will this individual deal with it?
right. Okay, so from what I'm getting is that you're saying that sometimes when people want to change and move out, people
Yeah.
around them try to bring them back into the cage, right?
Yes, yes.
Right. So one thing is that is where personal power and autonomy comes in when we talk about these things, that you have the power in your hand to change it through. And it's also very important to give them a very realistic picture to your clients that, see, if you're making a particular decision, it is not going to sit well with everyone, right? It is not going to please everyone. That is a very harsh truth and reality we all know. Like, if I choose to do something out of the box today, it is not going to make everyone happy, right? But you need to evaluate whether this decision is more important or making those people happy, right? So when you evaluate and when you do the pros and cons, and you can do the simple exercise that what do you think is the pros of not making the decision, what do you think is the cons of not making the decision, right? So then you can have a brief outline of it, that the things what you can do, right? And other than that, if you're saying on a very directive level, like let's say if you want to talk about a bit more serious cases, for example, domestic abuse, right? Those protocols have they become very different. There's also very important, it's very important to incorporate some social work element to it, right? For example, a woman trying to get out of the toxic household where her husband is physically abusive or sexually abusive. In those cases, you generally have to have a very strong protocol. Protocol in the sense that you should be having an emergency contact if the person is wanting to move on, and also take care of the legal aspects as well, right? But physically, I would say. Reaching out to those people and trying to change them is something that would be out of scope for individual psychotherapy.
Yeah, but in some cases where uh, the family or the individual, like they are like bonded with, I mean, it is like good relationship, but I mean, of course, there is no like with domestic violence happening,
Mhm.
but that individual is important for this client.
Right.
Uh,
Right. In what cases that, yeah, that is where you need to draw, do the pros and cons of it, right? So it's a very simple exercise. There's pros, there's cons, and there's a middle, right? You can ask your clients to just write down, like, what do you think are the pros of making the decision? For example, leaving the house, right? Leaving your husband, leaving your son, right? And what do you think are the cons of it, right? But the ultimate decision should be of the person, right? And when I say the cage is open, it's not necessary for the person to get out of the cage, right? The person can realize, yes, the cage is open and I have the power to get out of the cage, but I'm still choosing to stay because of so and so reason. If that much realization and that acceptance the person has, that is also, a great marker of progress, right?
no, that is at an individual level, that like I have to make certain things, but how will I convince or like convey the message that the change that I am making is for good or is for
To others, yeah.
yes, yes.
Yeah, that is again comes in the scope of interpersonal effectiveness, how you can convey to the people you think will be affected with the change. You can sit down and tell them that these are the issues that I'm facing and it's very difficult for me. That's why I'm making this decision. I know it might upset you. Somewhere also empathize with the other people. You can ask your clients to also empathize with the people whom you think are going to get affected, right? So yeah, that falls under some more of communication interpersonal.
Okay. 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 Thank you. Thank
So
you.
what is the name of this exercise?
It's called the cage drawing exercise now.
Okay.
Right. Yes. Momita, ma'am, then we'll take Manjuna.
Hello, sir.
Yes.
So, in my first picture, I am in the cage and I feel stuck alone also, and I couldn't find any door. Okay. And in my second picture, I find a door and the door slightly open, but I'm not getting out. I'm in the cage still.
Yeah. Yeah. That was basically what the drawing should have been. Like that is it exactly how like the exercise. Like you have to be inside the cage in both of the drawings, right?
Yes,
So that it acts as
yes,
a
sir.
metaphor that yes, that even though the door is open, you're still inside the cage. This is
Exactly.
basically the metaphor that you're going to use. Thank you so much for sharing. Yes, Manjuna.
Yeah,
After that,
thank
we'll
you.
move to
Yes.
therapies.
Should we instruct them to draw inside of the cage, or they can draw himself or herself outside of the cage?
No, they have to be inside of the cage for both the drawings,
Okay. Okay.
right?
So we have to instruct them to draw inside of the cage, and
Right.
the door will be closed
Yeah.
in first
First
drawing.
drawing, door closed. Both the drawings they're inside the cage. First
Hmm.
drawing, the door is closed. Second drawing, the door is open. But both of
Okay.
them are inside,
Okay. Okay.
right?
Okay.
Okay,
Thank you.
then we'll move to our last exercise, and this will also sort of be an assignment and which we'll reflect on. So it's called Draw Your Inner World. It's about worthlessness. I'll just briefly show you an outline about what to do. I can find it. So this is a different activity, but I would say just try drawing a brief outline of this. Draw a brief outline of yourself or your body. Right? It should not be colored. It should just have a black outline. Ignore the colored part. I did not have a separate sheet, but yeah, it should just be an outline of your body. Right? Make a human body outline. That's the whole instruction.
Did you mean just an outline of a human body, sir?
Yeah, yeah, outline of it. And post which, what you have to do is the interesting part is that you have to again use symbols and represent whatever you think is inside your body. Right? It could be qualities. It could be even if you think that you are not medically well, that is also something that you can represent, right? But it should just represent whatever is inside you, right? Not outside, right? It could be your achievements, your qualifications, anything, but whatever that is inside, right? Yes, ma'am, go ahead. You want to ask something? Okay, then we'll make it a bit short. We have already like sort of spilling out of time. We have it till 1. So we'll come back by 12:36. Right. We come back as a group now slowly. The assignment would be for you to finish this activity because it's a bit of elaborate activity at home. But based on whatever you've done now, we can have a small quick discussion and see what comes up, right? Okay. How does everyone feel? What feelings, thoughts are coming up? Anyone would like to share? Also, the same people are just sharing. What about the others? Can a few people want to share? Right. Anyone?
So may I?
Yes. Go ahead.
Yeah. So when I was drawing the inner self of me, so when you said that we need to write down or draw anything like whatever you feel and whatever is your qualities. So when I was writing each quality, like if I was writing caring, so related to caring, whatever the back incidents have happened or people have told me, likewise I was just writing it down. I was not doing what I was feeling, but what people have told me, that you are like this, you are like that, or you are helpful, or you are caring, kind of, you are emotional. All those things were coming into mind before, like what I was thinking, how I am actually.
Right. Thank you so much for sharing. That's a very important point that we are going to take forward.
Thank you.
Right. Yes, Shagorika, ma'am, go ahead.
Yes, while making this, the same thing what she said, that first thing which came in my mind, that what people think about me, because I don't know what I am. Whatever people talk about me, that is what makes me. And the
True.
main thought which comes in my mind is a gratitude for everyone who is around, who are around me.
That's great. Right. Thank you so much for sharing. Yes, Shafat, ma'am.
Hello. So when I was when I started drawing, I was actually empty. My mind. I could not first of all think of my achievements or what I am, and then I kind of broke it down to the relationships that I have. So like today as Mother's Day, so I started off being like I'm a mother, and then I realized yes, like being a mother is like I'm caring, I'm understanding, I'm listening to my kids all the time. So these qualities came up, and then I thought it's like what a mother is, right? But what am I as an individual? So then I thought, okay, I am good at art. I am now in the field of psychology, so maybe I could add those things. So then gradually things came up with my mind, but initially I think I was a bit blank in the start when we did this.
That's also completely okay, but see how you could build up, right? It was important for you to write the relationship that only gave the window for you to introspect on your own self, right? That made you think that, why am I writing only relationships? It's about me as well, right? Thank you so
True,
much for
true.
sharing.
Thank you.
Anyone else? Quick thoughts?
Actually, I want to share one thing, sir. I just
Yes.
mistook the activity. So
Right.
what I thought is that we have to fill a human body with some symbols. So I think I missed that quality part. So the thing which I drew is funny right now, and I think I should redo the activity.
Yeah, it was not exactly stickers. You could use stickers, but it was just anything that would, represent things that are inside, right? Things that you think are integral part of it. Right. So one of the major themes that comes up is, I think across for all of us, I remember when I also did the activity, I was writing down things which people have, told me or labeled me with, right? So my worth or my self-worth or self-concept overall was so much, for example, externalized, or it was very, I would say, focused on what people said, and on, dependent on external sources, right? That brings us to the concept of conditions of worth. Before we move to SWOT analysis, we'll go to conditions of worth. Now, this is a very Carl Rogerian theoretical construct, conditions of worth. So basically, he said that as we grow up, since childhood, we have been assigned conditions. So, for example, I am only worthy if, right? So let's take a case example. For example, there's a child whose parents are only taking her out to dinner if she's getting, or if she's becoming the first girl in class, right? So even though that the parents say that we have never pressurized her to be, she does it on her own, that is a condition that the little child is implicitly processing, that yes, only if I get first, if I become the first rank, then only my parents are going to take me out. So this is how exactly the conditions become, imprinted on ourselves and on our self-worth, right? And I think this, and you can't avoid it, because this is what happens to all of us, right? So this is not something that it is avoidable. What is avoidable is making your entire self about this only conditions, about these conditions, or placing your worth depending on these external sources, right? So it's completely normal to have those feelings. You are writing down only things that your people told us. That is where, which brings us to the idea of self-esteem and self-efficacy, right? So when you say and when you think that our esteem, self-esteem, how our, how much we are worthy, or how much we are able to do things, maybe professionally or personally, like, right? Because different people have different priorities. Someone might think that me being very good at my personal relationships, my family is more important than my occupation. For someone else it might be the other way, right? So these things, when they interfere with your level of functioning and how you view yourself in relation to your other family members or your workspace, that becomes a problem, right? So ideally, you should be aware of the conditions that have been put inside you, and you should be open to accepting them in the fact that yes, these things have happened to me, and sometimes I might feel this way, but this, I am not going to let this direct my entire life, right? So that is again where autonomy comes in. And along with that, you could also, another place area of reflection with your clients is SWOT analysis. SWOT is strength, weakness, opportunities, and threat, right? So I'm sure some of you have also incorporated your strengths and weaknesses both. So strengths correlate with opportunities and weaknesses correlate with threats, right? So when you're saying strengths are, areas of strength, we all know, and weaknesses, areas of weaknesses. So how can do you think that you can use these strengths to make it as, an opportunity for self-growth and working on yourself, right? And, perhaps for a depressed patient, getting out of depression, right? And what do you think are the weaknesses, are somewhere stopping you, are threat for you to get out of depression? So these are a few areas that you could reflect on when you're working and, using this activity, right? So I'll move forward. I'm almost about to finish. Okay. So, right. So you need to also understand that there is a tri-directional influence, like three of the elements influence each other. It's not linear, or it's not one way, right? So there's hopelessness, helplessness, and worthlessness. So let's take an example. For example, a person who's what there's progress in the worthlessness area, the person feels more worthy of themselves, might also start feeling more hopeful about the future, right? And then might also start feeling that yes, the world is helpful. I am going to get my way out. I'm not alone, right? Similarly, the opposite also might happen. Someone who starts feeling more hopeful also starts, feeling that yes, I am worthy. There is hope for me in future, and then automatically starts feeling, less helpless. So this is something also very essential that you need to understand and keep in mind that yes, these do not work isolated wise, but we also work together, right? Yeah. So post this art therapy for depression intervention, the triangle for your patient should somewhere look like this. There should be self-worth. The future should be built somewhere. There should be hope, and the world should be perceived as health. Right. So this is what an ideal situation is, and what usually happens when you know, incorporate these three techniques for your art therapy for depression intervention with your patient. Right. And now we come to the symptom monitoring
Sorry
scale.
for disturbing, sir. I just have a doubt here.
Yes.
Yeah. So during this session, when we conduct these assignments or activities to clients, are we going to conduct all these activities continuously, or we should give them some break for them to process,
Yeah,
or
yeah. It should not be on the same day, right? Take your time. I was coming to that, describe what how you can do it. So you don't have, so you can start with any one you think the patient is struggling with most, right? For example, the patient has extremely low levels of hope. Start with the hopelessness activity, right? Start with the line drawing activity and stuff, right? Now, on that, if you think the person has started building a conversation, the person is verbalizing, let the person verbalize for 1 or 2 sessions. You don't have to we did it in a workshop, that's why it was so cramped. With these techniques, usually you can spread out, right? Take your time and do it. Let the person verbalize. And if you think through only one activity, there's a lot of change in these three areas, it's not necessary for you to administer the other two activities as well, right? Because it's about them getting better and feeling better rather than you trying to administer the activity. So if you can it's completely up to you as a clinician, your discretion, which activity you are choosing first, and post that you take that up. If you think the person is not verbalizing, shift to the another activity, the next activity. But ideally it should not all be in a single session, and the time period there's no time limit for it. Let the person do as long as they feel like, right? I hope I've answered your question now.
yes, sir. Thank you, sir.
Thank you. Any quick thoughts before we move? Right. Okay. So these are the symptom monitoring scales. I remember Chaitra ma'am talking about it. We can do a pre-test, post-test. Now I'll briefly explain it. It's a very simple thing. So it's best to somewhere keep in mind how much your client is progressing and if your therapy or your treatment is actually working or not. How you can do that? You can do that through these symptom monitoring scales, which will give you a number. So let's take Hamilton's depression inventory, right? HAMD. This is the most widely used. I've also used with most of my patients. This and Beck's depression inventory, right? These two are things that are mostly used. So before your intervention, before starting with the art therapy intervention, ask your patient to fill out the questionnaire. Do the scoring, and you'll get a score, and it will follow through a norm. Yeah, he or she has moderate to severe depression, or mild depression, right? Now, ideally, that's called a pre-treatment test, right? Now, after you do the treatment, after you do these techniques and engage in the art therapy and the process, after that, again, administer the same scale, again, administer the HAMD and get the score again. Ideally, there should be a reduction in the score that will hint towards the fact that yes, the patient's there has been progress, the depressive symptoms are common, right? These are psychometric tools which are validated and reliable. So you should not like be jittery about applying that, right? So that is called the post test, right? So for example, for the first patient, you've seen the patient falls in the criteria of moderate depression, right? There's a score of moderate depression. After you do these exercises, art therapy and overall therapy, you again understand, see the score which is coming, it's falling under mild depression or it is not meeting the criteria for depression. That's a huge progress, right? You could track these things through this way. You can write these scales down. You just Google it. You can get it very easy. So I've also thought of including, the hopelessness, helplessness, and worthlessness. If you want to do it separately, assess these three elements separately as well. There are three scales. There's the adult hope scale, which is very common, the most common adult hope scale. It's based on Snyder's hope theory. There's contingencies of self-worth scale, CSWS, and there's learned helplessness attribution scale. So these are three scales. You can do pre-test, post-test, but usually what people do is they usually do the depression inventory and do a pre-test, post-test. That will help you monitor, right? So that is the monitoring. It's very important for you to see how much a client is making progress, because progress and noting progress is very important throughout the therapy sessions. Right. So these are markers of progress: verbalization or expression of thoughts about self and situation, expression of feelings through art making, expression of physical symptoms through art making, and treatment compliance. So treatment compliance, basically the fact that the client is coming back to you for therapy session. That is, I guess, personally, if you ask me as a therapist, it's a very big sign of progress that yes, your therapy is working, you're doing good work. When you see that yes, your client is coming back to you, right? And you can always ask them openly that, do you think this is working? If it's not working, what do you think can be changed so that it works for you, right? So these are a few markers of progress, and we have a case with it, which we'll be discussing, and I would want all of us to be very participative about it. So I'll read out the case, and then you have to somewhere highlight the areas that you think you're going to work with this client using art. Or maybe you can use these three techniques or any technique that Priya ma'am has taught you in the previous class, whatever you feel like, right? There's no right or wrong, and we are not here to judge anyone's competency, but we are here to learn from each other, right? Uh, I'll just read through the case. Mark, a 43-year-old man with a long history of depression, sought treatment after the end of his second marriage. He was in CBT for 19 sessions across 4 months, though much did not work. He further reported that he had periods of depression for as long as I can remember. In particular, he recalled his first episode of depression at age 12, shortly after his father abruptly left and severed all contact with Mark and his family. Currently, Mark describes his depression as a product of interpersonal avoidance and lack of social support. His primary symptoms included depressed mood, loss of pleasure in nearly all activities, excessive guilt and self blame, fatigue, difficulty concentrating, and occasional passive thoughts of death. On unsuccessful CBT treatment, he was referred to you for an art based intervention. What would you do? Okay, quick thoughts. There's no right or wrong again. Anyone? I would like to hear more people as well.
So may I start?
Yes, go ahead, please.
Yeah,
Thank you.
yeah, yeah. Okay, so from the case we can clearly see all the three parts we just saw through the activity. I sensed there was helplessness, hopelessness, and worthlessness also. So
Right.
we can administer all three ways, all three activities as you said in different days, and we can see what which area is getting better first, and we can go with that. I could also intervene, or I could also introduce some cathartic expressions through art, as ma'am said, few exercises, just taking a sheet and dropping a few drops of water in it and using colors, and
Right.
making the uh, the client very much comfortable with that first. And also I want to introduce few relaxation techniques with this as well. And speaking about art therapy in particular, I want to go about with lifeline activity and the cage activity. I want to emphasize on those both activities.
Perfect. Very good and very consolidated explanation. Yes, Shuman, go ahead.
Yeah, so I was thinking like I don't know about others, but I think we all know about the bucket of fear technique that we use. So over here, what we can do is we can change it into something bucket of support, and we can give that person some art materials and tell them, okay, you draw a bucket, make it as yourself, and then put stickers or post-it notes and make something that you can add for your own support that you think would be beneficial for you. So in
Right.
that way, we can give them the idea that they can think of what are the things they want, and they can keep on adding it to their own life. So I think that would be helpful for the point that they think as a product of lack of support. For that, it will be much helpful. And we can also use the case of directional influence over here, in the sense that if we give them a ball and tell them, like, it can be a sand ball, clay ball, anything, and we can tell them to make it in any shape where they think it can change into something else. Like, for example, if I give ask them to make a triangle and then say, okay, this triangle can be seen as your hopelessness. Now, what extra angle would you give yourself to help in your hopelessness? So make it a square. They can add something into it. They can redirect the shape and change. It can be a sensory activity. Plus, again, the lack of support can be also shown over there.
Right. Great insights. I think extremely important. These are some things I would definitely want to do. Like once, like start with therapy with him and build some rapport. Very great, and very these exercises might induce breakthroughs in the therapy process. Great work. Thank you so much for sharing. Yes, Shagorika ma'am, go ahead.
Uh, yeah, so as these two people said, it's very true that the person is finding himself worthless because he feels there is no hope and there is no one who can help him. First of all, when we should give him a time to talk, and there should be a rapport building session where we could sit and listen what his side of story, and we should give him a proper time, maybe 1 day or 2 day, let him speak out. So this will be a big support to him, and then we will go for some therapies like a lifeline therapy or a cage therapy, or as Shuman said, that bucket therapy. So this will help him out, and slowly, we can. First, we need to have that faith that there is a good relationship between both of us, and even we can ask him to do some scribbling work where we can find out the way he was thinking.
Right. Right. Thank you so much for sharing. True, and I think it's a very important element of any therapeutic process to have a good rapport with your patient. It's extremely important because without rapport, anything you're doing, it's just alien to them. They will not register that. Nothing is going to happen, right? So thank you so much for focusing on that. Thank you so much, ma'am. Yes, you can go ahead. If I'm reading right, it's TechX.
Yeah, my name is Brinda.
Yeah, hi.
So, my voice is audible, right?
Yes, it is.
Yeah. As an art-based therapist, first thing I need to create is safe and non-judgmental space for the client in order to express him freely for the art. And for the initial conversation, I just go for the promptings like I can ask him how he is feeling, and I will ask him to represent what his is in a world like that. Then I can go for the next things like how he is exploring his emotions and thoughts in terms of anything what he likes to go for drawing, or simply by making an collage making also we can use for this one. And simply I can go for anything like talk therapy also. This comes to a best one when he want to express because his unconscious feelings can be expressed if we because he is disconnected from the world, so he want a support for him. So the simply talk therapy also will express him a good one, and I can make him to feel their emotions by making a patterns of thinking, how the patterns of thinking he is reflecting, and encouraging his reflections through my dialogue as well as art they can create. So mindfulness also and a little bit of relaxation exercises can might be helpful for him. And
Right, true. I think, yeah. Okay.
yeah, this can be helpful in order to make little bit of coming out of the depression, and we can make him to find the meaning of his life by his own self discovery.
Right. True. Very true. I think you're emphasizing on talk therapy and how important it is to verbalize. So here is something that we also should keep in mind, that if you look at his history, he was in CBT for 19 sessions across 4 months, right? And much did not work. So when you say relaxation and mindfulness, I would say I'm all down for it to exploring that. But if you are thinking of a modality where it's just talk therapy, I think we could incorporate more elements to make it different for him, right? Which also brings me to another question: how would you psychoeducate this patient? And what are the key elements that you would perhaps, want to incorporate in the psychoeducation and introducing art therapy to him? Even if it's just pointers, that's also fine.
Yeah, can I?
Yeah, go ahead.
So please, can you repeat the question again?
Um, Raksha ma'am, yeah, let me get back to you after this. Yeah.
Can include him with the sand therapy also might be feeling good, and few of the colors will make him to express more.
Right. Okay. Yeah. We were thinking of how, brainstorming about how we could, as a, as therapists, also psychoeducate and introduce him to art therapy. Right. Sumon, you want to go ahead?
Yeah, so I was thinking on the rounds that all these disorders, what happens is that after they get the diagnosis for a long time, they internalize that they think they are depressed. So what we can do and use for a psychoeducative interaction is that we can take watercolors on a white page and slightly we can show them that that white page is them, and it is the colors that are the depressive symptoms or depressive states that come through. So we can wash it off and it can be faded away, but it does not become the part of you. So in a way we can psychoeducate them. You are the paper. Whatever is happening with you is the phase that comes on. It's not you who are depressive or who is depressed. It's something you are going through. So that would be a good initiation for the psychoeducation.
Right. Right. Great. Great. Because it's very important, and I really like the fact that how you're, slowly also picking up to tailor these techniques and modify it and, tailor it according to your patient's needs. Perfect. Good way. One thing, what I would do is that I would use this history of CBT not working, right? Use it in the sense that put that forward that yes, you have been in therapy and probably these are the things your therapist has discussed with you, and sort of evaluate, when talk and evaluate at what exactly was that is did not work, right? And for example, the person says, I don't know, I mean, he was just asking me to think about my thoughts and, recognize my feelings, right? It was not working. Use that and say that, okay, we are going to do something different here. We are going to use art materials. And then you talk about the myths of art therapy, that you don't have to be an artist and everything. And then you psychoeducate after about your depression, how art therapy can help in depression. If you want to incorporate the neurobiology of it, you can do that, right? So these are some things that I would, as a therapist, would do as well. So I think all of us have great insights, and thank you so much for sharing. Before closing, I have there's some other techniques which is called paint your feelings, which is important for catharsis, and mapping pain in your body, somatic relief. So you just draw outline of your body, and if you feel a particular area that's painful, you just color it and then you talk about it. Safe space drawing, relaxation, the safe space for grounding, relaxation. Based on that. Thank you. We are done with our 2 hour long session. I would want to ask you, how was it? Anything that we could improve on? Anything that you liked? Anything that you want us to continue? Some feedback would be nice from your side. Anyone before we close? Thank you so much, Manjuna ma'am.
Sir,
Yes, go on.
sir, we'll be getting any activities which we have done. I mean, any worksheet or anything, so that we can use further with our patients.
For this, there's no worksheets because you have to pretty much do it all yourself, the cage or the lifeline and everything. But I'll be posting on the group about the assignment, what you need to. It's related to the third activity itself, and that you need to submit. But yeah, there's no worksheet as such for this. You can
Okay,
explore
sir.
some CBT based art worksheets.
Yes, sir. Okay, sir. And sir, again to remind you, sir, I want the material to read about the
neurotransmitter.
Neurobiology. Yeah, I'll send it. I'll send you. Can you drop me a personal text? I'll
Sure, sir.
send you some material.
Thank you, sir.
So is this a part of the assignment that we have to upload in the drive?
I'll let you know that. I'll let you know what you.
Okay. So thank you very much, sir. It's a very enriching and a very nice Sunday morning. And many
Thank you
things
so
we
much
know,
for being so
but
patient.
we don't practice. We don't practice. Not only for our clients, it's good for us also to know ourselves. Thank you very much.
Thank you so much, ma'am, for contributing. Thank you.
So I want to give a feedback for the session because
Yes.
I felt that as a fresher, I can understand how the whole session is going to be taken. You just shared a very detailed insight. I really want to appreciate it because you just exactly said where to start, how to go about, and what can be inculcated. And thanks for sharing your insight. Thanks for
Thank you so
beautiful
much,
session.
Akshay, for being participating. Thank you so much. Right. Anyone else? Any insights, last thoughts before we close? Okay, then I guess we would be closing. I'll just take a quick screenshot for all of us. If we can have a few video on, that will that be fine? So that we could try to take a screenshot for all of us as a group. Right. Okay. Right. Thank you so much for being so participative, for being so supportive. And in case you want to discuss something specific related to your clients or patients, you can DM me. You have my number over group. You can DM me and we can see how we can take that forward, right? Thank you so much. Take care. Have a great Sunday and take adequate rest.
Thank you.
Thank you so much, sir.
Thank you.
Bye. Bye.